warm welcome. We would first like to thank you for agreeing to be part of this unique initiative which seeks to address the concerns in people's minds with regards to COVID-19 vaccination and living in the new normal. India is just about recovering from the COVID pandemic and is restarting again. This period of COVID infections has been tough and the challenges haven't quite gone away as yet. The risk of COVID infections continue as we unlock and start to resume our lives. Today we have with us experts to share with you advice on how to continue living long and healthy with COVID vaccinations. Today we have with us Dr. Tejas Kamat. He is a director and consultant at Diabetes Care in Goa. We also have Dr. Gaurab Bhaduri, who is a consultant in the Department of Diabetes and Endocrinology at Medica Superspecialty Hospital and Apollo Sugar in Kolkata. And then we also have Dr. Uday Jadhav, consultant cardiologist at MGM New Bombay Hospital in Navi, Mumbai. My question first to Dr. Tejas Kamat, is it essential to get vaccination? Should we wait for better vaccines to come along?
Absolutely essential for those who are right now eligible to take the shot to go out and take the vaccine as early as possible. Remember, both vaccines which are available with us in India today, the Covishield and Covaxin, they have shown almost 100% efficacy in preventing deaths out of COVID-19. They have been highly effective, so almost efficacy is around 90 to 100% in preventing serious infections out of COVID-19. And they have moderate efficacy between 80 to 90% in preventing moderate COVID infection. So I don't think there is any need to wait for better vaccines. We should go out and take the shot as early as possible.
Right. Dr. Gaurab Bhaduri, now to you. How does the COVID-19 vaccine work in prevention of the COVID-19 virus?
Okay, so currently we have Covishield with us, which is a viral vector-based vaccine, and we have Covaxin, which is the inactivated vaccine. Once the vaccine goes inside the body, they have a little bit different process in which they produces the antigen to the antigen-presenting cell, the antigen being the spike protein. But once it does so, then onwards the process is quite similar. The antigen presenting cell then processes and presents this antigen to the helper T cell. And from there on, there is activation of B cell and there is production of protective antibody. And then there is also activation of cytotoxic T cell, which will kill any cell inadvertently, infected with the virus. And then they go on to produce memory B cell and memory T cell also in the long term. And basically the body is now primed against COVID-19 infection. So if there is a future infection to a patient who is already vaccinated, the immune response will now be more robust and more faster, and thereby preventing the COVID-19 infection from happening.
Right. Dr. Uday Jadhav, there are many myths that people on blood thinners and those who have recently been through any kind of surgical procedure should avoid vaccination. Is that true?
These blood thinners are used in what we say primary or secondary prevention. Patients who have had heart attacks or strokes and are on aspirin or clopidogrel, these are typically the blood thinners. It is absolutely safe to take these vaccines.
Right.
Now there is a different type of medicine called anticoagulants. These are medicines which prevent the blood clots. Typically these are given for patients who have stroke, for preventing a new stroke from occurring, because let's say irregular heart rhythms. Now, when a patient is on this blood clotting medication, there are two varieties. There were the older ones. They are called warfarin and acetone, and they have been tested by a blood test called prothrombin time. The recommendation is to our viewers, those patients on a higher dose should see to it that their prothrombin time is within the effective limit. So that's the only advice. For the newer ones, they don't really need to worry. What they need to do is tell the vaccinator that they are on this medication. When they're administered this vaccine, they can apply a little pressure so that the swelling or hematoma doesn't occur on the site. But really, one should not rub that site, and there is really no need to worry. So please, all patients should take the vaccine.
Dr. Tejas Kamat, can people with type 1 diabetes take vaccination? Is it safe, or does a person need to check blood glucose levels before getting themselves vaccinated? Also, should one stop taking insulin on the day of getting themselves vaccinated?
Patients with type 1 diabetes can definitely take the vaccine shot. While it will be prudent to have a good glycemic control so as to prevent long-term complications which are associated with diabetes, for taking the COVID vaccine, either Covishield or Covaxin, you may not check your blood sugars. You may just go out simply without doing a blood test and get the COVID vaccine shot. Because even if the sugars are high, it's not known to increase the risk of vaccine-related side effects. As far as your other question was concerned, with regards to patients with type 1 or even type 2 diabetes, there is no recommendation to stop either insulin or any of the oral anti-diabetic patients that one patient might be on the day or while taking the vaccine shot. It has to be continued.
Dr. Gaurab, Bhaduri, should patients with diabetic nephropathy and those on dialysis take this particular vaccine?
Yes, so this is again a very important question, because we know that at more than 1/3 of our patients of diabetes has some form of kidney problems going on with them, and they can very safely take this vaccine whether they have any stage of chronic kidney disease or even those requiring dialysis. Now, the only thing that I want to point out over here is that actually the government has prioritized in the 45 to 59 years age group that patients with end-stage renal disease requiring dialysis is actually a priority group, because these patients has been shown in several studies to have a very high risk of having severe COVID infection and even COVID-related death.
Doctor, I have a little bit of a confusion. If I take the vaccine, it does not mean that I will not get COVID-19, but does it mean that it will not be fatal and the severity will be a lot less now that I have been vaccinated? Is that right?
Yes, because the efficacy of the vaccine in overall is around 70 to 90% in both the cases. So interim trial with Covaxin has shown around 81% efficacy, but that again is an interim analysis, because full analysis is yet to come. And for the AstraZeneca or the Covishield vaccine, there has been two separate efficacy data. I am not going into those details, but in average it is around 70%, but it might vary between 60 to 90%. But if you look at having a very severe infection or death due to COVID, death due to COVID is 100% protected as far as the results have come till now. Risk regarding getting severe infection is also very minimal. So that is the benefit of why if you receive the vaccine, and in this special groups, as I talked about, will benefit a large by receiving the vaccine.
Right. So, Dr. Tejas Kamat, are doctor visits in clinics and hospitals, are those safe at the moment?
I wouldn't say absolutely safe, because we have not yet been able to vaccinate majority of a patient population. To a large extent, that's because of the availability and other logistic issues. So I think it's not absolutely safe for doctor visits. But yes, we also don't want to lose our patients in the sense the patients may get complications and some other ailments, and we may lose them because what we call COVID-like situations. So they may not die of COVID, but if we don't visit the hospitals, or the patients or doctors don't visit hospitals, the patients may end up losing their life because of some other ailments. And that's why I request all our patients, if they have some issues, important issues, and need to consult a doctor, please go out and meet your doctor.
Right. So with that, we're slipping into a very short break, but I'd just like to put in a word for our viewers that taking a vaccine, according to our doctors, is absolutely safe, and anyone and everyone should go out there and get a vaccine if they are eligible at the moment, are in the category to be able to get themselves vaccinated. With that, we're slipping into a very short break. Lots more coming up on the other side. Stay with us. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccination. At this point, I would urge our viewers who are in the eligible category to please go get a COVID shot. Now, my question to Dr. Uday Jadhav, is there any special advice or tests that are needed for the elderly before vaccination? Should current medication be stopped before taking a vaccination?
Yeah, Devi, a lot of patients do inquire whether I need to stop my blood pressure lowering medication or the cholesterol lowering medication. Absolutely no. Please do continue it on the day of vaccine too. Absolutely safe. There is no, that's one. The second part of the elderly people, really speaking, it's the elderly who are at more risk. So if you look at the vaccine data, 70 and above, 80 and above, even patients at the age of 90s are still eligible for vaccine and they do benefit a lot from the vaccine. Now, do they need any special tests? No, not really. Occasional patient can have very regular heart rhythms. They may get their EKG checked. But then, frankly, it doesn't really make a great difference and they should go ahead and get the vaccination.
Right. Dr. Tejas, Kamat, what are the common side effects of the vaccine? Are the side effects common to both?
Yes, so largely the side effects of both Covishield and Covaxin are almost the same. So if you have taken the shot, most likely you are likely to experience the local injection site reaction. So there might maybe redness, swelling, itching, or kind of a burning sensation at the local injection site. You may get mild fever, body ache, muscle and joint pains. You may experience slight headache or dizziness on the day of vaccine or the next day. There are other less common side effects like nausea, loss of appetite, gastric intolerance, which have been reported. But what I'm very happy to say here is, as we are talking today, more than 3.5 crore of our Indian population has been vaccinated, have received at least one shot. And I'm very happy to say that no serious side effects have been reported from any part of the country.
Right. Dr. Gaurab, Bhaduri, post-vaccination, can one stop wearing a mask? That is the big question and the biggest worry amongst people at the moment.
Yes. So first of all, you should not stop wearing a mask, neither social distancing or neither hand sanitization protocols, because of two reasons. One is for your own safety, because after you receive the second shot, you will need around 3 to 4 weeks at least to build a strong immune response. And secondly, because we don't have enough data regarding the transmissibility of COVID-19 after you have been vaccinated. So you may not get the infection or may not develop a severe infection, but you might still transmit it to somebody who is vulnerable.
Right. Doctor, can you just take us through the do's and don'ts regarding the vaccine?
Yeah, so the do's will be that you can do almost all your other works and everything with the vaccine. I would say the don'ts are like that: don't open your mask or move without the mask. Social distancing and all the protocols you follow as you've been following before.
Right. Now, Dr. Uday, Jadhav, do I still have to quarantine after I've been vaccinated if I'm identified as a close contact to someone who might have had COVID-19?
Oh, absolutely. I endorse the view of the social distancing and mask and quarantine completely. So let's put this in perspective. Let's say if you have to, overcome one myth, people believe that when the vaccine is 95% efficient, it means that 95% of the people will be protected. It doesn't work that way. Let's say if 100,000 people are there in the community, and the incidence of COVID-19 infection is 1%, then 1,000 people would get infected. If we vaccinate this 100,000 people, the number of cases will be then 0.05%, that's just 50 cases. These 50 cases, despite vaccination, can still get, as we just heard, a COVID infection. Now it becomes very vital then to prevent the transmission. So there is no way in which one would continue to discard the ideas of social distancing or mask or quarantine. I think it's absolutely essential.
Right. Dr. Tejas, Kamat, post-vaccination, are you fully safe from the risk of COVID-19 or are there still chances that one might contract the virus?
Is the vaccine 100% effective? So we have to understand two important points here. First, the neutralizing antibodies, the sufficient immune response develops only 2 or 3 weeks after the second dose. So if somebody has just taken the first dose or taken the second dose only a few days back, he may have not yet developed a sufficient immune response and still may be at risk. And second important point to note is that prevent us from getting symptomatic COVID. So the risk of mild, moderate or severe COVID infection or deaths will be reduced. They may not be effective in preventing the virus from entering our body. So we may still end up getting the virus and maybe an asymptomatic carrier and maybe transmitting the virus to others. And that is precisely the reason why still continuing with the COVID appropriate behaviors, masking, social distancing and hand hygiene remains very much essential till the time we are able to vaccinate many.
Right. And Dr. Gaurab, Bhaduri, should people with thyroid conditions take the vaccine? Is it safe? Should medication be modified, stopped on the very day of the vaccine?
The answer is an absolute yes. So all patients of thyroid dysfunction, even if they have autoimmune thyroid disorders of hypothyroidism or hyperthyroidism, they can very safely take the medication. The immune pathway in which the autoimmune thyroid disease happens is quite different from the way the immunity is built when COVID-19 vaccine shot is given. So they are entirely different. So they should be prioritized. Regarding your second questions, that is there a need for adjusting or altering the dose on the day of medication? No. So whatever the dose the patient is on, as has been prescribed by their doctor, they need to continue it before, during and after COVID-19 vaccination until and unless it has been changed by their doctor.
Right. And my last question to Dr. Uday Jadhav. Doctor, how long does the protection from the COVID-19 vaccine really last? That is the big question that everybody is wanting an answer to.
Absolutely. That's going to be the holy grail, as we can put it. It looks like it's going to last for sure and certain for 3 months and beyond. Now, whether it can last, let's say, for a year and beyond, we need more data to come. That data is not as clear. The neutralizing antibodies against, let's say, cold shield, the anti-spike protein, comes up about 3 weeks after the second dose. And it's not necessary that the antibody levels decides the level of immunity. So we need not make a mad rush at laboratories to get our blood test done. I don't think that's required. So let's put it this way. 3 months for sure, may last for a year. If there are mutant strains beyond the established mutant strains, then we don't have a clear idea about it. And that's more the reason that all other preventive measures will still fall in place.
Right. Thank you so much, Doctor. My very last question would be, when can we expect other vaccines like the Johnson & Johnson to make its entry into India?
I don't think we need to go on waiting for a specific vaccine to come. These are single shot vaccines with an efficacy close to 95% in clinical trials. But I guess we are a large population. And rather than pick and choose a vaccine, it's important that we receive the vaccine dose, right? For example, as a health worker, and a frontline health worker for COVID, I got my first shot on the day one when the government of India started it. So let's not wait. All vaccines are good. Let's not pick and choose.
Right. Thank you so much, doctors, for joining us on our special show. And as we end the show, a quick reminder to our viewers to go and get a vaccine as and when they're eligible. Thank you so much for your time.